My name is Fabio Januario. I'm a researcher at the Uninove Institute in Portugal. I will not present a clinical study, even an app. I'm not talk about a specific disease. So I just talk about share and have access to health data and health information. And yes, of course, the smart bear have these steps to start to have this access, but I will show that can be more easy if you use some of the new regulations and new visions that exist in the European health data space. So regarding the xShare project, the vision is that everyone can share their health data in the electronic health record exchange format with a click of a button. Saying European electronic health record exchange format, it's difficult, so I will use exchange format in the rest of the presentation. Okay, so the idea here is to have a button that allows this for all the citizens, and to demonstrate that this xShare button is possible to use and can be used for continuity of care, also for clinical research and population health. And we'll make this test in 8 adoption sites across Europe and demonstrate that it's trusted and safe to use these kind of strategies and use this exchange format to do that. For that, we are building also the European Electronic Health Record Exchange Format Standards and Policy Hub that help to use the format and also in a sustainable way to continue to promote the usage of the format. Is composed by SDO, so it's important to have all of these institutions' engagement. And just to have a clear vision of the consortium, it's a big consortium on the project, but we have some SDOs, some industry partners, some research institutes, also some academia, and also some national institutions, some national agents, regional agents, and also hospitals. So we have a big group of partners working in this project. And to give a more or less overview of all the project, then I will focus a little bit on the button, on the xShare button. You have this exchange format standard hub with all the specifications and technical specifications that you need to use the exchange format. And then you are using this exchange format for data portability for the patient right to access their data, also for public health and cross-border perspective, and also for clinical research with some core set of important fields for research, and also working on IPS plus R and see what is needed to make this data available for research purposes. In parallel, we are also working on an adoption monitoring framework to see what is advantage of use of the exchange format and the level of maturity of their usage regarding of European health data space. Also, capacity building, cybersecurity, so understand what is needed for healthcare professionals, for citizens, for institutions to use the exchange format. And finally, the xShare industry label to see if the institutions are using correct this exchange format or not. But I'm talking about European health data space, exchange format. Maybe I need to explain a little bit more what is that. So regarding the European health data space, it said that is supposed to use the European electronic health record exchange format, and is supposed to guarantee that any natural person have access to their health data, have the capability to download this data, have capability to view who is accessing this data, also set some access restrictions, so can say what is the healthcare provider can see or not their health information. Also the opt-out from data sharing, it's possible to ask. Also insert information in their electronic health record system. This is not so commonly nowadays. And also to appoint some authorized person to access their health data, and final request for form rectification. So this is all the rights that is described in this European health data space regulation, and that need to be fulfilled by all European countries and also all electronic health record systems. So European health data space is not only for primary use of data, it's for primary use of data for improving patients' access to health data, but also for secondary use of data, make all of this data available for research. And also, it's creating a single market for these electronic health record systems with some requirements that need to comply. This is the requirements, these two big requirements that are putting into regulation. So it's needed to harmonize components to all electronic health record systems. One of them is the interoperability component, so ensure the capability to import and export data in exchange format. And the other one is the login component that is supposed to log all the access to the data in the systems. Regarding this format, in this exchange format, they also have three main components. The first is the data set, so the structure of the data that is supposed to be used. Then the coding systems and the value sets to code all the health information. And finally, the technical interoperability specifications to make possible the exchange of this information. And also in the regulation, we have the first 5 priority categories of data that you need to share and make available to the persons. So it's patient summaries, e-prescription and dispensations, medical test results and related reports, and also medical image studies and related reports. This is the 5 priority categories, but today in these presentations here, it's more related information that you need to start to put in the exchange format. So all of this data that is captured by these wearables in these projects that you see before, maybe you can put some of them in the patient summary, but not all of them. So you need to start to thinking also in new periodic categories, but first you need to deal with these 5. So what is this xShare yellow button? So the xShare yellow button, the idea for the button is to include this button in the portal applications from healthcare providers and apps, and is to have the people the right to download and have access to their data in the exchange format. So the data is delivered to the citizen in the exchange format. To give an overview what is envisaged for this button, so we have the healthcare institutions that have their health record systems with our data. We have also national health infrastructures that have this data available, and also have some apps that you can use with this kind of health data that you can somehow access with yellow button. So the yellow button can be put in these applications, such as web portals or mobile applications, and give to the patient the information in the exchange format. But we have 3 basic functionalities for that. The first one is just download this information. So the patient access the yellow button, see the information that are available, choose which information want to store in their device, click download, and download that information. The other one is one-time share, is a normal sharing, a snapshot of the information. Then the yellow button generates a shareable link, and then the citizen can send this link for many purposes and share this information. And finally, the link option is the same thing of the one-time share, but is a long period for this link to be available, and the information that is available in this link is the most recent one. This is important, for instance, for the patient summary. It is changed in time, so you can use the same link and see the last version of the patient summary. When the citizens have this information with them, they can share with many purposes. So can share with all other healthcare professionals, even national or cross-border context, with a relative one, or even with a third-party app, such as some apps that you have where you can put all your health information and you can have your personal health record. So it's possible also to ingest this information in these systems. They just need to accept this exchange format. This is the important. Regarding the testing of this button, you are working in 8 adoption sites across Europe in different contexts. So we have one business context related to a French partner with an application for clinical studies. We have national context with some national institutions here in Greece, Ireland, Denmark, and Cyprus. And we have also some regional context with Catalonia in Spain and Madeira in Portugal. And finally, we have also the hospital context, written hospital in Italy. Regarding, just to have an overview of what our adoption sites are thinking about and are trying to do, this is our priority categories, and this is our adoption sites, and then you have these icons that say if they are interested in download, in on-time share, or leak options. As expected, the patient summary is that priority category that is more interested for the adoption sites, but we have also a new one that is the care plan that is developed by the Denmark adoption site. This is a new proposal for a new the priority category to use the exchange format. And to finalize, I will put here some links where you can have some information. So in the left side, we have the XBundle registry where you have many information regarding the exchange format, the technical certification that is available at that time, is a joint work between xShare and Xpand projects. And in the right side, we have the first version of the implementation guide of the xShare yellow button with all the information regarding this button is an ongoing process. And I think that I can stop 1 minute after the time.
Thank you, Fabio. So, yeah,